A very good afternoon, Mahwera say Sanmonani. I hope you are doing well. I got a question here. Was a South African denied medication or medical attention in Zimbabwe? Indeed, a South African national was airlifted from Zimbabwe that was in late April 2025, when they fell ill in Bulawayo, where the person was working. And an ambulance transported them from Bulawayo to Beitbridge, where they were airlifted by a helicopter to South Africa. So there's been a lot of, statements regarding this as to why Zimbabwe denied this individual medication or medical attention. I'm gonna tell you this. There is no way Zimbabwe was going to deny somebody medical care if they could. You've got a lot of Zimbabweans traveling to South Africa for medical attention because they don't have access to it. The healthcare system in Zimbabwe is something else. And the Limpopo province really highlighted that the airlifted a patient was not denied medical care. And in a statement, Premier Ramatuba says the patient could not be assisted in Zimbabwe due to what she calls logistical challenge. And logistical challenge is the truth of the matter in Zimbabwe. Is the truth of the matter in Zimbabwe. You have seen high-ranking officials seeking medical attention in South Africa, India, Singapore, and all other countries. Robert Mugabe died in Singapore. Morgan Tsvangirai died in South Africa. Our VP Chiwenkwa was treated in South Africa, India, and as well as in China. We have seen this happening. It's in the news. You can check this out on social media. You can Google this information. You will find it. Because our healthcare system in Zimbabwe is a disaster. I'll give you a very clear example. Somebody very close to me gave birth to premature twins. That was in the 90s. Okay? And those twins nearly died because the incubators were not working. This is at a public general hospital in Zimbabwe. The kids nearly died. She told us the story over and over and over. Fast forward 2022, that person's daughter gave birth to a premature child at the same general hospital. The incubators are not working. They had to buy a gas heater to bring in their room so that they can, keep the temperatures warm. And when this lady narrated the story, she said nurses brought in another kid who was seriously ill just to warm him up. She says she watched that kid die because it was too late. We have had so many examples of how the healthcare system is a disaster and people cannot be assisted. Recently, the Lutumba Tollgate bus accident, that's Masvingo Beitbridge Highway, where a tragic bus crash claimed 25 lives. This is in early 2025. People could not be assisted. Their wounds were dressed, using cardboard boxes and tape. You saw that. It's all over social media. The Seke Road crash, 17 people died. Emergent medical response team struggled to stabilize victims due to shortages of essential equipment and consumables. There was an incident where This guy was just crying. I just need Panado. He died crying. He just needed Panado, the painkillers. But he could not be assisted. So to say somebody was denied medical care in Zimbabwe is actually not true. It's just some propaganda being pushed by people or just lack of information or the clear understanding of the healthcare system in Zimbabwe. If you've got a family member or someone who fall ill while in Zimbabwe, you better look for ways to take them out of the country, back to South Africa or any other country. It's a crisis, even for citizens in Zimbabwe. The lady I mentioned who admitted in 2022 with a premature child, they had to walk at 12 a.m., heavily pregnant, from a private hospital to the public hospital. They couldn't afford the private hospital, so they were told to go to a public hospital. Walked at 12 a.m. There is no ambulance. So if you don't have the resources, you don't have money for whatever situation, that's how it is. And this is in town. The person could not afford um, to even call a private taxi to come and fetch them. So serious cases, be it accidents, serious illnesses in Zimbabwe, right now, it's not safe. Yes, I've seen some renovations happening in Harare, at the Parirenyatwa and all other big hospitals. But in terms of medication and all that, yeah, we've got good doctors and nurses that we can give them, but without proper equipment, it's just a disaster waiting to happen. So to people who might be treating Zimbabweans anyhow because you think that our country denied your own people medical attention, that's not true. That's not true. They did not deny anyone. And I really appreciate the Limpopo province for what they did for the South African. They really had to act fast. Otherwise, a life could have been lost. Well, there's not much details regarding what the person was suffering from, and the healthcare or the Ministry of Health in Zimbabwe did not share any more information regarding that. So I just want you to look at our own leaders who had to seek medication in other countries. That's how bad it is. So however we we got to this situation as a country, that's not my topic today. I just wanted to highlight that to fellow South Africans who might not understand the current situation in Zimbabwe. And back to the influx of Zimbabweans seeking medical attention in South Africa and the debate around it. I will tell you this. Over the years, South Africa have been providing free medical attention, free medical care to foreign nationals, speaking for people who are documented here. Giving birth in South African hospitals has been really free. As long as you are documented. Those who are not documented, I know some who gave birth at public hospitals, no hassles, no problems, for free. But recently, when they went back to collect proof of birth, the stamped one, they were told to pay. You are not documented as a foreign national. I know a couple of cases like that. But they were not really denied any medical attention. When you get there, the doctors will save you, put a bill on it if there is any. But yeah, that's the situation in South Africa. So let us not get all this propaganda or everything that is happening right now cloud our judgment on the real truth of the matter, be it the current health situation in Zimbabwe and the current situation in South Africa right now. People have been really receiving medical attention, but things have been changing where foreign nationals, especially the undocumented ones, been requested to pay. And there are some who are documented. I know a lady who is back in Zimbabwe now, who was told at public hospital in South Africa that they cannot do kidney transplant. She has to go to a private hospital. They matched, but then found out that the person is a foreign national and said, no, we really have another patient who is a South African who needs that kidney. So you have to go to a private hospital. So that's the issue right now. They have to prioritize their people. So it's not a case of just Dudula standing at the gate and saying, we don't want you as a foreign national. There are certain things that they are now prioritizing their own people and charge foreign nationals depending on the case. But also, in for the most part, they are not really denying anyone medical care. You can just go in, they assist you, but put a bill on it. So my advice to our foreign nationals in South Africa is that just get any medical insurance that you can afford at the moment. That's the best you can do for yourself. I know most people who are affected by this do not afford that. They don't afford any insurance. But yeah, that's the way to go. Just get it, or just now get more information on private doctors, private clinics, what they are charging, and be prepared to pay for it. If you really can't pay for it, just look for ways to get help and see what you can do. One lady that I know went to a public clinic with a child. This is for their immunization. And the nurse told her that, yeah, I'm going to assist you, but next time I'm going to charge you. You are foreign national, I'm going to charge you. But they assisted the person anyway. So the amounts they are going to charge for that, I think it's going to depend on the clinic that is going to be saving you. I do believe that they are working on something to make sure that the charges will be something affordable. But in the meantime, try to get any insurance that you can. If you are documented, walk around with your passport wherever you go, carry your documentation, saying, I know my rights. I am here, and all that might not really save you, might not help you. You are at the mercy of whoever is assisting you. So the arrogance and fighting with the police, telling you know your rights and things like that might not help. I'm not saying be treated badly and keep quiet because you are not in your in your country. We do have our own human rights, but let us be more appreciative and speak to people nicely. I've been in public departments, be it the health sector, education sector, in South Africa. There is always somebody willing to assist you wholeheartedly if you go there with humility. Go there with humility. When you get there and you are talking to a doctor and tell them your situation, I'm humbly asking you to assist me. This is my situation. I've been on call with SARS, even sometimes when I'm out of the country. I've called certain departments, the bank, to sort out certain information from outside the country. But it depends on your tone and how you approach someone. But we go there with some sort of entitlement. We go there with some sort of, it's my right. Even in where I just know that I've got rights, I'm fully exercising my rights. There is a tone that you use. After all, you are going to a healthcare institution and you are being rude. Man, if there is something that you need to really be careful about and treat that person nice, is a person who save you food and the person who take care of your medication. This is very important. This is very important. It's okay to shout and write whatever you want on social media, but a person who saves you food and a person who take care of your medication, man, those two people, I'd be very careful. I'd be very careful. If they don't want to assist me, no matter how I approach them, I better go somewhere else because I don't know. This is a human being that we're talking about. Forget about what they signed up for and the oath they took. We've seen so many cases. Kids were swapped, and years later, people find out, you are not the real parent. Somebody was just being spiteful. We've got those people in different departments. So to my foreign nationals, just be careful. You are in another country, you are vulnerable no matter the situation. Your approach right now matters. Be respectful. Don't just follow the crowd. There are so many people on social media who are just attacking. Those people can afford private doctors. Those people can afford to go to India, to Singapore. So when you see people writing, oh, this is a banana republic, this is a whatever, that's not your fight. Those are not your words. How you feel at some point does not matter. You stay humble. You respect people. Just to respect people and that's it. There was a time, though documented in South Africa, where I was in some situation and I was talking to the police, trying to explain myself in some, oh my God, my Shona accent, but trying to speak Zulu. You know, those cops laughed. They really laughed. Found it funny, like, okay, where are you going, sissy? And they dropped me off. It was late at night and I needed help. They assisted. They were laughing at me. I didn't approach this as it is my right. I'm documented. So what? I didn't do that. But it could have easily turned out to be something else. There are certain things that we need to approach differently when we need people's sympathy and help. And this applies to where we are working. There are some things that I learned the hard way. There are some things that I had to self-introspect before approaching them. Like, okay, this is where I'm at. I need to get to a next level of my life. I need to get to the next stage. But how do I get there? This does not just apply in South Africa and the situation with Dudula. In all aspects of your life, be it in business, be it in civil society, approach to other family members. Arrogance doesn't take you that much far. It doesn't. There's a different approach that you can use that can get you what you want. I know there are some people who say, I hate that, I hate that I have to be. Yes, you hate it, but you are in that situation. When you are dealing with people, learn that. Just know how to approach this. I've spoken to some young people in civil society when I'm doing youth empowerment programs. I've gone to schools both in South Africa and in Zimbabwe, um, doing all these youth motivational speaking. And I've learned that there is so much that our people don't know when it comes to approaching different situations. We just think we can just march in and exercise our rights. Yes, you can. You can. You can do that. But I want you to measure the results when you were humble and when you exercised your rights? What worked better? What worked better? I once worked for a very difficult boss, um, someone from North Africa. I'm mentioning where they come from because I want you to relate to how they kind of approach things, the brutal approach, how they can be. So he shouted and asked me like, what is he, why is he paying me? You know. So my response to him was, "Oh, I'm so sorry that you feel that way. I didn't notice that I had not really contributed much. Would you kind of advise me or kind of mentor me on how to approach situations like this? You can guide me. We can, put a 3 months probation in this situation. And if there are no results, you can let me go. You can let me go." I'm talking about somebody who was busy spitting insults. He just turned around and was like, "Oh, okay, I think that can work. 3 months and that's it. I'm gonna, give you some KPIs. This is what you're gonna do, and this is what I need. Every morning at 7 a.m., you and I are gonna work on this." We did that only for a month. At the end of the month, I had a raise. I could have just responded with, why do you have to shout at me? Why do you have to speak to me like that? I could have done that and it could have ended in any way. But within that period, I learned so much that elevated me. I earned more money. Why I'm highlighting this, even though it might sound not really relevant to my topic here, or why I decided to do this video regarding the healthcare system, is the approach. And this is something that I'm seeing our people are kind of missing in South Africa. That's why some South Africans are saying we are entitled, we are arrogant, we don't respect. It's the way sometimes we just feel entitled and feel that I can always respond in any way in any situation. You can calm the storm. The situation in South Africa right now, it needs people who can calm the storm. But as long as we have got certain individuals sitting at the back of the mic, the keyboard, hiding behind ghost accounts and throwing punches at South Africans, it's not going to help the people who are vulnerable right now. So to you, foreign national who feel that you can say whatever you want and do whatever you want, think about the vulnerable people and take a step back. Let us have people who are calm right now in this situation to deal with the situation. If you feel that you can insult and punch back and take South Africa back to when they were assisted, that approach right now seems not to be working. If there are gonna be any conversations, let us do these conversations with sober-minded people. Thank you so much for watching. Keep subscribing and let us have these conversations. Thank you.